Warning: 9 dangerous morning signs of diabetes you need to know. Have you ever noticed that your body might be sending you signals first thing in the morning and you didn't even realize it? If you have diabetes or know someone who does, the first moments of the day could reveal much more than you think. Small symptoms that seem harmless might actually be a warning sign that your blood sugar levels are out of balance. And the most concerning part? Many of these signs are easy to ignore, but they could indicate something serious if not recognized in time. In today's video, you'll discover 9 morning signs of diabetes that often go unnoticed. Stay until the end, because number 6 on this list might be the most dangerous and unexpected one. Let's make a commitment. If you're determined to transform your health and take control of your blood sugar, type in the comments, "I choose to break free from diabetes." As soon as I see your comment, I'll leave a heart. This simple action can make a big difference because it activates a mechanism in your brain called commitment confirmation, which increases your chances of sticking to this positive change. And if you know someone who also needs this information, share this video. That way, together, we can help more people live healthier and more balanced lives. 1. Tingling or numbness. Have you ever woken up with that strange sensation of numbness or tingling in your hands and feet? This could be one of the first signs of diabetic neuropathy, a condition caused by high blood sugar levels that damage the nerves. Nerves act like wires, transmitting messages between the brain and the rest of the body. But when they are damaged, they can start to malfunction, leading to uncomfortable sensations like numbness, tingling, or even pain, especially in the hands and feet. These symptoms can occur at any time, but they tend to be more noticeable in the morning, after hours of no movement during the night. If left untreated, nerve damage can worsen, leading to loss of sensation, which may cause small wounds to go unnoticed. And in more severe cases, this could lead to serious complications like infections and even amputations. If you wake up with these symptoms often, don't ignore them. Consulting a doctor could be crucial to prevent future problems. 2. Morning headaches. Have you ever woken up with a pounding headache for no apparent reason? If you have diabetes, this could be an important sign that something isn't right with your blood sugar levels overnight. This happens for 2 main reasons. If your blood sugar drops too low, your brain may not get enough energy, leading to a painful headache upon waking up. On the other hand, if blood sugar spikes too high, the excess glucose dilates blood vessels, causing that throbbing pain in the morning. If this happens frequently, your body may be trying to warn you about blood sugar fluctuations while you sleep. But the good news is that some simple steps can help prevent this discomfort. Stay hydrated. Dehydration can trigger headaches, so drinking water regularly makes a big difference. Prioritize good sleep. Establishing a nighttime routine, avoiding caffeine before bed, and creating a calm environment can improve sleep quality and reduce headaches. Manage stress. Emotional stress can directly impact blood sugar levels and increase headache frequency. Relaxation techniques like deep breathing, meditation, or light activities before bed can help maintain balance. If you frequently wake up with this symptom, pay close attention. It could be a sign that your blood sugar needs better control. 3. Night sweats and waking up. Drenched. Have you ever woken up in the middle of the night or early morning to find your sheets damp and your pillow soaked in sweat? This could be a sign that your blood sugar levels dropped too low while you were sleeping. Nocturnal hypoglycemia occurs when blood sugar falls below normal levels during sleep, and in response the body releases adrenaline to try to restore balance. The problem? This process can trigger excessive sweating, even if the room is cool. Besides intense sweating, some people also experience vivid nightmares, shakiness or trembling, extreme fatigue upon waking up. All of these could indicate that your body struggled throughout the night to compensate for a blood sugar drop. If this happens frequently, here are some steps that may help. Avoid going too long without eating before bed. A small, balanced snack can help prevent sudden blood sugar crashes. Monitor your glucose before bed and upon waking up. This can help identify patterns of nighttime hypoglycemia. Consult your doctor for medication adjustments. If low blood sugar episodes are frequent, you may need to adjust your insulin dose or other treatments. If you often wake up drenched in sweat and feel exhausted, don't ignore it. Your body might be signaling that your blood sugar management needs adjustments. Shall we move on to the next sign? But before that, I want to ask you to help others. You're not the only one struggling with diabetes. Many others are too. Let's help them together. All you need to do is like this video and share it with someone you know who is dealing with this condition. I truly appreciate your help. Now, let's continue. 4. Morning fatigue. Did you sleep through the night, but instead of feeling refreshed, you wake up exhausted, as if you never rested at all? This could be a sign that your blood sugar levels are out of balance. When blood glucose levels are too high, the body struggles to convert sugar into energy. The result? Instead of waking up feeling energized, you might feel like you ran a marathon in your sleep. If you frequently wake up feeling drained, it could be a warning sign that your diabetes needs better management. And the worst part? This fatigue isn't just limited to the morning. Many people report feeling exhausted throughout the day, making even simple tasks much harder. To avoid this problem, it's essential to monitor your blood sugar levels regularly and adjust your diet, sleep habits, and daily routine as needed. Small changes can make a big difference in your daily energy levels. 5. Morning hyperglycemia. The dawn phenomenon. Have you ever woken up feeling groggy, thirsty, or even a little nauseous without knowing why? It might seem like just a rough night's sleep, but for people with diabetes, this could be a sign of morning hyperglycemia, also known as the dawn phenomenon. Here's what happens. During the early morning hours, your body releases hormones like cortisol and adrenaline to prepare you for the new day. These hormones signal the liver to release glucose into the bloodstream. For someone without diabetes, this isn't a problem, but if your blood sugar is already unbalanced, this process can cause it to spike even higher as soon as you wake up. This glucose surge can be even more intense if your diabetes management isn't well adjusted or if your medication wears off overnight. And the problem doesn't stop there. This morning spike can make it harder to control blood sugar for the rest of the day. If you've noticed this pattern, one of the best strategies is to check your blood sugar first thing in the morning and talk to your doctor about possible adjustments to your medication or diet. Small changes can help prevent this effect and keep your body more balanced. 6. Morning nausea, a warning sign for your health. Waking up with an upset stomach might seem like a temporary discomfort, but if it happens frequently, it could be a sign of something more serious. In people with diabetes, morning nausea could indicate a condition called diabetic ketoacidosis, DKA, a dangerous condition caused by the buildup of acids in the blood. This occurs when the body can't use glucose for energy due to a lack of insulin. To compensate, it starts burning fat instead, producing ketones, substances that, in excess, make the blood acidic, leading to nausea, vomiting, and even confusion. Although DKA is more common in type 1 diabetes, it can also occur in people with type 2 diabetes, especially when blood sugar levels remain uncontrolled for long periods. If left untreated, this condition can lead to serious complications. If morning nausea has become a frequent issue, don't ignore it. Your body might be warning you that your blood sugar control needs adjustments. This discomfort could be one of the first signs that something isn't right. By the way, these symptoms aren't limited to the morning. They can appear at any time of the day, depending on blood sugar levels and individual factors. However, many of them become more noticeable in the morning due to hormonal changes and effects like morning hyperglycemia. Pay attention to your body's signals, and if you notice anything unusual, seek medical guidance to prevent future complications. 7. Irregular heartbeat upon waking up. Have you ever woken up feeling like your heart was racing or beating irregularly? This could be a sign of blood sugar fluctuations during the night. When blood glucose levels rise or drop suddenly, the body can react by sending signals to the nervous system, affecting heart rate. Hypoglycemia, low blood sugar, can trigger a surge of adrenaline, making your heart race first thing in the morning. Hyperglycemia, high blood sugar, can put extra strain on the cardiovascular system, making circulation more difficult and causing palpitations or chest discomfort. If this symptom happens regularly, it's a warning sign to check your blood sugar levels and evaluate your diabetes management. Here are some ways to help maintain balance. Practice relaxation techniques before bed. Reducing stress can help prevent sudden glucose fluctuations. Keep a blood sugar journal. Monitoring your morning glucose levels can help identify patterns and make adjustments easier. Adjust your nighttime diet. Avoiding sugar spikes before bed can minimize fluctuations. If your heart frequently feels out of rhythm when you wake up, consult a doctor to better understand what's happening. Small adjustments can improve your quality of life and help prevent future cardiovascular complications. 8. Blurry vision upon waking up, a warning sign. If you wake up with blurry vision and think it's just because you're still sleepy, pay attention. This could be a sign that your blood sugar levels are out of balance. When blood sugar is too high, it can cause the lenses in your eyes to swell, temporarily affecting your ability to see clearly. This happens because excess glucose draws fluids into the eye's lenses, altering their shape and making it harder to focus. Although this symptom can occur at any time of the day, it's often more noticeable in the morning, especially if glucose levels were unstable overnight. If you wake up with blurry vision often, your body might be warning you that something isn't right. The good news is that some simple habits can help protect your vision and reduce the risk of complications. Monitor your blood sugar regularly. Keeping glucose levels stable can prevent these fluctuations that affect your eyes. Avoid smoking. Smoking damages blood vessels, including those in the eyes, which can worsen vision problems. Protect your eyes from UV rays. Wearing sunglasses helps reduce the risk of cataracts, a common complication in people with diabetes. If blurry vision has become a frequent issue in the morning, don't ignore it. It could be a sign that your glucose levels need better control. Small adjustments can make a big difference in maintaining eye health and preventing future complications. 9. Dry mouth and excessive thirst, a nighttime warning. Have you ever woken up feeling like you just crossed a desert with an extremely dry mouth and an unquenchable thirst? This isn't just normal morning thirst. It could be a sign that your blood sugar levels were too high overnight. When there's too much glucose in the bloodstream, the body tries to get rid of the excess sugar through urine. This makes the kidneys work overtime, leading to frequent urination, sometimes even waking you up multiple times during the night to go to the bathroom. This symptom is known as nocturia. The problem is that while you sleep, your body loses more fluids than it can replace, leading to dehydration. The result? You wake up with a dry mouth and extreme thirst as your body tries to rebalance its water levels. If this happens frequently, pay attention. It could be a sign that your glucose levels are out of control overnight. Some simple actions can help prevent this discomfort. Monitor your blood sugar levels in the morning. This can help determine if you had a glucose spike while sleeping. Stay hydrated throughout the day. Drinking water regularly can help prevent dehydration and reduce extreme thirst in the morning. Avoid high-carb meals before bed. Balanced snacks with protein and fiber can help keep glucose levels more stable overnight. If waking up with excessive thirst and a dry mouth has become a constant issue, don't ignore it. Your body may be signaling that your glucose control needs improvement to avoid long-term complications. If you've made it this far, it means you care about keeping diabetes out of your life, and that's already a big step. How about taking the next one? Now, on your screen, you'll see 2 videos about diabetes. Pick the one that interests you the most, and I'll see you there. See you soon.